Picture this. You wake up with that heavy, familiar pressure low in your belly. You walk to the bathroom, sit down and wait. Nothing. You try again later. Still nothing. By the third or fourth trip, the feeling changes. It is no longer simple constipation. Now there's pain, a deep, dull ache. It spreads from the lower belly into the pelvis and even the lower back. You feel full, bloated, a little sick, maybe even shaky. And somewhere in the back of your mind, a quiet voice starts saying, something is not right. If that feels close to home, stay with me, because this is one of those problems people ignore until it turns into something dangerous. Today we are talking about stool that gets physically stuck in the rectum. What it is, why it happens, the warning signs people miss, and what to do next, step by step, in plain English. No sugarcoating, no confusing medical talk, just a clear explanation that could help you or someone you love avoid a serious emergency. By the time this is over, you will understand what your body is trying to tell you, why this problem builds slowly, and why waiting too long can become a real risk. And yes, this matters even more if you are older, caring for an older parent, or helping someone who cannot explain what they are feeling very well. So take a breath, slow down for a second, and keep listening, because the next few minutes may answer a question your body has been trying to ask for days. What is happening here is called fecal impaction, but forget the formal label for a moment. In simple terms, stool has stayed inside the colon too long, lost too much water, and turned into a hard, dry mass that no longer moves out the way it should. Your large intestine is built to pull water from waste. It does that very well, almost too well. So when stool sits there for too many hours or days, your body keeps taking moisture out of it. Soft stool becomes firm. Firm stool becomes dry. Dry stool becomes something dense, thick, and stubborn like packed clay. This usually does not happen all at once. That is what fools people. Most cases build slowly over several days. You may still pass a little stool during that time, which makes you think things are moving, but only part of it gets out. More stays behind, then more piles up, then it hardens again. Think of trying to force a rough stone through a narrow hose. The harder you push, the tighter it gets stuck. That is why constant straining can make the situation worse instead of better. And this is exactly where many people go wrong. They think if they just sit longer, push harder, or wait one more day, the body will finally clear it. Sometimes it does not. Sometimes it jams. And when it jams, the signs can be sneaky at first. Mild fullness, less appetite, pressure in the rectum, a strange feeling that you need to go but cannot finish. Those early signals are easy to ignore. That is why this conversation matters. This problem often whispers before it screams. Now here is why this happens so often in older adults. After age 60, several things start working against normal bowel movement at the same time. The muscles of the intestines may move more slowly. The nerves that signal fullness or urgency may become less sharp. Many people also take medications that slow the gut without even realizing it. Pain pills, iron tablets, calcium, some blood pressure medicines, some antidepressants, some allergy drugs. Even medicines that help in one part of the body can quietly create trouble in another. On top of that, many older adults do not feel thirst the way they used to, so they drink less water, sometimes for days, without noticing how dry they have become. That low-grade dehydration makes stool even harder. Add reduced movement, more time sitting, maybe less fiber, maybe weaker abdominal muscles, and the setup is complete. This is why I want to say something clearly. If this has happened to you, it does not mean you failed. It does not mean you are dirty, careless, or weak. It means your body is dealing with a very real set of physical changes that nobody talks about enough. And that silence is part of the problem. People feel embarrassed, they wait, they hope, they say, maybe tomorrow, but tomorrow becomes day 4. Day 5, day 6, and by then the body is not just uncomfortable, it is under strain. Keep listening, because the next part is where things get tricky. Some of the most important warning signs do not look like constipation at all. In fact, they can trick you into doing exactly the wrong thing. One of the most confusing signs is watery leakage. A person may look down and think, I cannot be blocked, I have diarrhea, but that can be dangerously misleading. When a hard mass of stool is stuck low in the rectum, softer waste from higher up in the colon may still try to come down. It cannot pass through the center, so it slips around the edges and leaks out as liquid. This is often called overflow diarrhea, and it tricks people. They assume they have a stomach bug or food poisoning, then they take medicine to stop diarrhea. That is the wrong move. If a blockage is the real problem, because medicines that slow the bowels can reduce movement even more and give the impacted stool extra time to harden. So if there is watery leakage along with rectal pressure, lower belly heaviness, or the feeling that something is still stuck, do not brush it off. That pattern matters, and it is not the only misleading sign. Another one is feeling like you are going to the bathroom often but never finishing. You may push out a very little, enough to think something is happening, but the main mass stays there. That repeated false hope is part of why people wait too long. They tell themselves, I am still going, so it cannot be serious. But partial output does not always mean the system is clearing. Sometimes it means the blockage is only letting tiny amounts pass. This next part is important, so stay with me. The body can send signals through nearby organs too, and that is when people start blaming the wrong body part while the real issue keeps getting worse in the background. The bladder is one of those nearby organs. The rectum and bladder sit close together in the pelvis, sharing a tight space. So when the rectum becomes swollen with a large, hard stool mass, it can press against the bladder and the urinary passage. Suddenly, the person feels the urge to pee but can only pass a weak trickle, or they feel like they need to urinate every few minutes, but almost nothing comes out. That can be tied to severe constipation, not just a bladder issue. Then there is lower back pain, not sharp, not always dramatic, more like a deep ache across the low back, hips, or upper pelvis. Many people assume they slept wrong, overworked a muscle, or are having an arthritis flare. But when rectal pressure builds, the pain can radiate in strange ways. It does not always point neatly to the bowel. And in older adults, there's another sign that families often miss completely. Sudden confusion, agitation, or just seeming off. A senior who is backed up badly may become restless, irritable, foggy, or less alert than usual. That can happen when the body is under stress, uncomfortable, dehydrated, or starting to react to a blockage. So if an older person becomes suddenly different in mood or clarity and also has bowel trouble, do not ignore that combination. It matters. This is where the situation stops being a simple inconvenience and starts becoming something that deserves respect, because once stool is truly impacted, the body is not just uncomfortable, it is under mechanical pressure. And if the pressure keeps building, the risk rises fast. Do not click away here, because this next part may be the most important part of everything I say. A fecal impaction is not just about being unable to go, it can become a real medical emergency. As pressure builds inside the bowel, the stretched intestinal wall can lose blood flow and function. The muscles get tired, they stop moving well, waste backs up further. What began as a blockage low down can start affecting more of the colon above it. Then comes stronger symptoms: nausea, vomiting, a swollen abdomen, feeling weak, ill, or feverish. And in the worst cases, the bowel wall can tear. If that happens, material from inside the intestine can spill into the abdominal cavity, causing a severe infection that needs emergency treatment. That is why waiting too long is not a harmless gamble. So what are the danger signs that mean stop waiting and get help now? A hard, rigid belly that hurts to touch. A fever over 101 degrees Fahrenheit. Strong abdominal pain that keeps getting worse and does not let up. Vomiting that will not stop. Complete inability to pass gas. Faintness, cold, clammy skin, or sudden confusion. Those are not sleep on it symptoms. Those are get medical help now symptoms. If any of those are happening, go to urgent care or the emergency room, or call emergency services if the person looks very sick. That is the correct decision. Not overreacting, not being dramatic, just smart. Now let us move into the part everyone wants to know. What do you actually do when you think stool is stuck and you are not yet in the danger zone? The first step is simple, but most people resist it. Stop straining. Right now. Stop bearing down. Stop turning every bathroom trip into a battle. That hard pushing usually does not fix an impaction. It often irritates the tissue, increases pain, and can cause bleeding, tears, or swollen hemorrhoids. If you suspect stool is stuck low in the rectum, one thing people commonly try at home is an adult glycerin suppository from the pharmacy. It can help add lubrication and draw moisture into the area, which may soften stool near the exit. If you use one, follow the package, directions, or the guidance of a clinician or pharmacist. In general, it helps to lie on your left side because that position lines the lower bowel up in a more natural way and takes some pressure off the area. Use lubricant if needed, be gentle, And once it is inserted, give it time to work. This is where impatience ruins the attempt. People insert something, wait 5 minutes, then rush to the toilet and start pushing again. That usually does not help. The body often needs time, sometimes 30 minutes, sometimes longer. The goal is not to force the bowel. The goal is to let moisture, lubrication, and natural reflexes do some of the work. If there is movement, good. If there is only a little, do not panic. If there is pain, bleeding, severe swelling, fever, vomiting, or strong abdominal distress, do not keep experimenting at home. Get medical help. And let me say this plainly. Do not start mixing random laxatives, anti-diarrhea pills, and repeated aggressive bathroom attempts without understanding what is going on. That trial and error approach can make things messier fast. Warm fluids may help. Gentle walking may help. Calm may help. Force usually does not. This is one of those moments where doing less, but doing it more wisely, matters. Stay with me, because what happens next depends on how your body responds after that first careful attempt. And knowing when to stop home care is just as important as knowing when to start it. If nothing meaningful happens after a careful first attempt, give your body some time. Walk gently around the house, sip warm water, breathe, let the gut settle. Sometimes movement and warmth help the intestines wake up a little. If symptoms remain mild and there are no emergency signs, some people make one more cautious attempt with simple over-the-counter support, again following directions. But if there is still no result, or the pressure feels worse, or the person seems more ill, that is the moment to stop treating this like an at-home problem. Go in. Urgent care or the emergency room can do more than guess. They can examine the abdomen, check the rectum if needed, and use imaging like an abdominal X-ray to see how much stool is backed up and where it is sitting. That matters, because a rectal impaction is one thing. A larger bowel blockage is something else. In a medical setting, they may use stronger treatments such as medically supervised enemas or other methods based on what they find. And if the stool is very hard, very low, and not moving with safer measures, a trained clinician may need to remove it manually. That sounds scary, but it is a known medical procedure. When done by professionals, it is handled with care, lubrication, and pain control when needed. The point is relief and safety, not shame. Nobody in that room is shocked by constipation. They have seen it before, a lot. So please do not let embarrassment delay the right care. This is one of those issues where pride can cost you time your body does not have, and time matters, especially in older adults, especially in people who are frail, dehydrated, bedridden, recovering from surgery, or using medicines that slow the bowels. The faster the real problem is recognized, the easier it usually is to treat. Once the current blockage is handled, the bigger question becomes this: why did it happen, and how do you keep it from coming back? Because if the setup stays the same, the cycle often repeats, and usually faster the next time. The first long-term pillar is hydration. Water matters more than people think. The colon pulls water out of waste. If the body is already running dry, stool turns harder much sooner. Many older adults do not feel thirsty until they are already behind. So waiting for thirst is not a reliable plan. A steadier plan is to drink water through the day on purpose, not all at once, not only with meals. Regular intake. A glass in the morning can be especially helpful because fluid entering the stomach can trigger the body's natural urge to move the bowels. The second pillar is movement. The intestines respond to physical activity. Walking after meals can help wake up the gut. It does not have to be intense. A gentle 20-minute walk is still useful. If walking is hard, chair exercises, easy stretches, or guided movements can still support bowel motion. Too much sitting slows everything down. That is real. The third pillar is paying attention to patterns. If a person usually goes once a day and suddenly has gone 3 days with almost nothing meaningful coming out, that is worth noticing. If there is a pattern of tiny amounts, hard pellets, heavy straining, or constant fullness, that is worth noticing too. Your bowel habits are part of your health data. They tell a story, and if you ignore the story, the body may tell it louder later. This is your reminder to pay attention early, not late. Prevention is quieter than crisis, but it matters more. Medication review is another major piece. A surprising number of everyday drugs can slow the intestines. Opioid pain medicine is a big one. Is far from the only one. Iron can do it. Calcium can do it. Some blood pressure medicines can do it. Some mood medicines can do it. Allergy medications and others can add to the problem too. That does not mean you stop your medicine on your own. Do not do that. It means you ask your doctor a direct question. Could any of my medicines be contributing to constipation? And is there a safer bowel plan while I take them? That one question can prevent repeat emergencies. Another issue is overuse of stimulant laxatives. These are products that push the bowel to contract harder. They can help in the short term, but if someone depends on them every day for long stretches, the gut can start leaning on that outside push. Then natural bowel movement may become even less reliable. So if someone is using stimulant laxatives regularly, that is a good reason to talk with a clinician about a safer, longer-term strategy instead of guessing in the pharmacy aisle. Routine also helps more than most people realize. The bowel likes rhythm. The body often wants to move stool in the morning, especially after waking and after breakfast. If you can, sit at the same time each day, not for half an hour, not straining, just giving the body a calm, predictable chance. Over time, routine teaches the gut what to expect, and posture matters too. A small footstool under the feet can lift the knees and put the body in a more natural position for passing stool. It seems almost too simple, but for many people it changes the mechanics in a helpful way. Small shifts repeated daily can prevent very big problems later. There is also a message here for caregivers because many severe cases happen in people who cannot move well, cannot speak clearly, or do not want to complain. If you are caring for an older adult who has not had a real bowel movement in several days, who seems swollen, uncomfortable, restless, or suddenly more confused, do not assume it will sort itself out. Pay attention, ask direct questions, look for clues. Are they eating less? Are they drinking less? Are they going to the toilet again and again with nothing happening? Are they having watery leakage in the underwear? Are they saying their back hurts for no clear reason? These details matter. In frail adults, constipation can turn serious faster because their bodies have less reserve. Their tissues are often more delicate. Their dehydration can worsen quickly. Their pain may show up as agitation instead of clear words. That means waiting for dramatic symptoms is not a good strategy. Early action is better. Encourage fluids if they can safely drink. Help them move or change position if they are able. Keep track of when they last passed stool. And if there is doubt, call their doctor sooner, not later. A quick assessment can save a major complication. Also, do not let embarrassment lead the conversation. This is not a rare or strange issue. It happens often in hospitals, nursing homes, rehab settings, and private homes. It is a medical problem, full stop. And medical problems deserve calm, practical attention. If you are still with me, this is where everything comes together because the final takeaway is simple but powerful. The earlier you recognize the pattern, the easier it usually is to stop it from becoming a crisis. So let us bring it home. Stool stuck in the rectum is not just being a little backed up. It can start quietly, disguise itself with misleading symptoms, and turn dangerous if people keep waiting and pushing. The red flags are there if you know how to see them. Repeated urge but little output, strong rectal heaviness, watery leakage that looks like diarrhea, trouble urinating, lower back pain, bloating, and in older adults, sudden confusion or unusual agitation. The emergency signs are even clearer. Severe constant pain, fever, vomiting, a rigid belly, inability to pass gas, faintness, or signs that the person looks truly ill. If those appear, do not delay. Get medical help. If the symptoms are milder, stop straining, stay calm, use simple measures carefully, and know when home care has reached its limit. Then act. That is the part I want you to remember most. Not fear, not shame. Action. Early, sensible, informed action. Your digestive system affects far more than comfort. It affects appetite, energy, sleep, movement, focus, and quality of life. When the bowels stop moving well, the whole body feels it. So take it seriously, talk about it without embarrassment, and do not ignore what your body keeps trying to say. If this script helped, save it, share it, and send it to someone who needs to hear it. Because a lot of people suffer through this in silence, and silence is exactly what lets it grow. Drink your water, pay attention to the pattern, and if something feels off, trust that feeling early. It is always easier to respond before the whisper becomes a crisis. A